Cavity fillings. Do they hurt? First, the dentist will check your mouth with the help of a few dental instruments and check the cavity. He or she may then take an X-ray to check the extent of the depth of the cavity. Then, he or she may apply a numbing agent or a gel around the area to be numbed. This is done so you will feel very less discomfort while you're being numbed. Sometimes you wouldn't even require to get numbed because the cavity could be very shallow on the tooth surface. Once the area and the tooth is numb, your dentist uses dental instruments to remove the decay. Once the decay has been removed, the dentist will sterilize the area and prepare the tooth for a filling. Certain type of fillings will require to be cured or hardened with the help of a blue-colored light. Finally, your dentist will check your bite and will do some polishing to make sure you have no bite issues before leaving the clinic. Once the numbness has worn off, your tooth may feel a little sore, but it should go away in a few weeks. You will be asked to avoid taking anything too hot or cold for a few days till the filling sets in.